This video is about the 3T formula that will secure your Philhealth claims revenue. If you or your hospital staff will understand this key concept and act on it, your hospital Philhealth claims income will potentially increase. Hello, my name is Coach Doc Ben. I was a former Philhealth claims chief. I am the founder of UHC Clinical Claims Consultancy. We teach healthcare providers in decreasing Philhealth claims return, decreasing Philhealth claims deny, and increase Philhealth claims income. If you are serious in claims reimbursement, this video is for you. If you stay till the end, you will discover the importance of the 3T formula in relation to your Philhealth claims processing. If you think this topic is useful for you or your hospital, if you wish to know more on Philhealth concepts like the Claim Form 4, universal healthcare, no balance billing for private hospitals, please smash the like button and subscribe to this channel. Now, let us proceed. Now, the efficiency of claims operation is important in any hospital's financial performance. Having an efficient and a well-trained hospital claims staff is a make or break in any hospital. So, hospitals' Philhealth claims processing covers many steps from patient registration to the time when the patient is discharged or when the benefit is exhausted. So the steps have three parts. First step is the front end office. This covers patient registration, Philhealth eligibility verification. The next step is the middle office. So the tasks are related to clinical care, diagnosis. This is then converted to the ICD-10 as well as the RVS code and charge capture. Now, the last step is the back office, wherein the task covers claims preparation, claims submission, then payment posting or processing of the statement, management of claims return, the management of claims denied. So my personal rule of thumb is that hospitals' reimbursement is a reflection of the three offices. Now, in my experience, if your hospital fails in any of the listed tasks or in all of the three offices, be it front, the middle, and the back end, your claims will be denied, your claims will be returned, and probably goes to legal. So the 3T formula that will prevent claims returned or claims denied are the following. So our first letter T is all about teamwork. Now, though this may sound like a broken record, patient registration, you have coders, billers, collectors, financial counselors, managers, doctors, nurses, all must work together. So the back-end staff must work well with those at the front-end people. This means hospital staff in patient registration, eligibility verification must work hand in hand with the claim staff, with the billing staff, medical records, as well as the clinicians. Now, effective Philhealth claims team have a shared purpose and they must work together to fulfill it. Now, it is important to note that hospital claims processing does not sit in isolation. everybody must be involved. Now, I have a video related to this concept of claims teamwork. Now, click the link here or here to understand it better. So, why the emphasis on teamwork? Now, permit me to share a very interesting example. One of my clients, a level 3 hospital, kept on losing an estimate of around 200,000 pesos per month in reimbursement. So, the back office staff reviewed the claims and noted that the problem was due to poor documentation by the resident doctors. So, the resident physicians were not consistent in documenting clinical admissibility requirements like patient signs and patient symptoms. So the claims staff, informed the medical residents about the issue. Now, their motivation to cooperate in the claims process increased dramatically, which eventually led to a decrease in claims returned and claims denied. Now, the next T in the 3T formula is training. So, the secret to hospital Philhealth revenue success lie in education. Now, however, many hospital executives do not understand the monetary value of Philhealth education and its effect on Philhealth claims processing. Now, education sessions may be expensive, but so is the lack of training. Medical errors and preventable claims inconsistencies result in unnecessary denial and unnecessary return of Philhealth claim. Lack of communication or misunderstood communication or information may keep Philhealth claims from being properly coded, which ends up being denied. Now, for example, several hospitals in southern Mindanao lost at least 100,000 pesos to up to 3 million pesos worth of claims due to inconsistencies in information. Believe it or not, 5 of them got letters from Philhealth Legal. So, the potential legal problem is basically more expensive than training your staff. Nonetheless, if hospitals and healthcare organizations take education more seriously, perhaps the return of investment is one step closer. Now, many of the hospital owners and hospital leaders see Philhealth training as a mere expense. It is not an investment and it is not their priority. So the same is true with hospital claims processors. Processors see Philhealth training as unnecessary. They see it as time-consuming. Their overconfidence is basically misplaced. They see it as an add-on to their already delayed and tons of tasks on hand. Now, as a result, these claims processors keep on repeating the same mistakes. So, claims are denied and claims are returned. Now, indeed, educational training takes money and time, but a well-trained staff understands that educational advancement may promote return of investment. Now, the last T on the 3T formula is technology. So, effective Philhealth claims management starts with patient registration process and runs all the way through final payment. Naturally, patient care is the primary focus, but efficient claims processing keeps the doors open and the lights on. Therefore, It is essential component that you cannot ignore. So your PhilHealth claims reimbursement basically pays the bill. So one way to be more effective at hospital PhilHealth claims processing is to implement technology to automate hospital processes. Now, the following is a look at how implementing technology or automation can result in immediate boost to your hospital finances. These are the following: clinical management systems, electronic medical records, electronic claims, email encryption, and attached solutions. So technology in claims processing leads to the following: increased efficiency. So by removing manual or paper-based or less automated digital processes, your staff can free time to focus on other tasks, be it research, industry trends, new service offerings, or new marketing opportunities, or probably just devote themselves to providing good patient care. Now, another advantage is you eliminate paper. So printing and chasing paper documentation is not only time-consuming and bad for the environment, but it opens you to human error. So lost or unreceived communications, additional paperwork, or faulty lagging email service, and more. So errors, rather, can mean claim denial and return, and leads to delayed payment, which basically increase in claims receivable. Next is cost savings. So finding a technology provider that offers multiple technology services can provide savings to the entire operation. When you work towards digital automation, your hospital can save thousands of pesos over what you might spend on paper and even hourly pay for your staff, as they require more time to complete the task. And consolidating the vendor's services like claims, EMR, and encrypted email means cost savings for you, and as a bonus, having a single service provider means better customer support and less time in inquiries by talking to them through phone or through the web. And of course, that is if you have an efficient third-party IT provider. So in summary, if your hospital is serious in PhilHealth claims processing, the 3T concept or the 3T formula, which are teamwork, training, and technology, if done efficiently, will potentially increase your claims revenue. Friends, I hope you were able to get that. If you like this video, tell me what you like about it. If you have specific claims topic you want me to discuss, just post it in the comment section below. If you want to learn more on PhilHealth rules and PhilHealth concepts, please subscribe this channel. This is Coach Doc Ben. See you in the next session.